thank you for this invitation. I am new at Southern Maryland, about 5 months, so but not at all a stranger to this community. We'll have the next slide, and just to help acquaint you, Southern Maryland Hospital Center was started in 1977 by Dr. Caramonte, Dr. Francis Caramonte, and that was at a time when our county really didn't have access to a lot of health care, and so it was a great thing that they did. The hospital, next slide, is today, we are a 227-bed acute care facility with an additional 24-bed subacute unit. Last year we saw probably a little under 15,000 admissions in total, and another 5,000 or so observation patients. Next slide. I'm going to try and go quickly here. So the emergency department, of course, saw just under 60,000. That's not a good thing, and that's a statement about the lack of access to health care. Next slide. Another aspect of our hospital, we had about 8,000 or so surgical visits. Just to give you a size and concept of the hospital. Next slide. But a very important milestone happened in the course of this hospital, and that happened in December 2012. And in December 2012, the Caramonte family sold Southern Maryland Hospital Center to MedStar Health. MedStar Health is it's actually the largest not-for-profit healthcare system serving this vast region, and it's a true talk about a new song. We went from being a private hospital, for-profit hospital, to a not-for-profit hospital. So the focus is absolutely under MedStar Health. It is now all about our patient-first value system, and it's all about how do we be the trusted leader in our community, caring for the people, whether our patients, our associates, or the broader community at large, and how do we advance health? And the word is advancing health, not health care. So the focus is on the community. I'm not going to go through all the ways that the healthcare world is changing, and in particular for the hospital. Vinny mentioned to you, I have a public health background. My background, if you go to the School of Public Health at Hopkins, you know it's all about how do you take very scarce resources and put them in the right place to help keep people healthy. And that's my entire career, wherever I worked, that's been my focus. This population health world is coming to, should have always been our focus, should have always been, but our payment system didn't incentivize it or encourage it. And the great news is that day is changing. Unfortunately, it's changing because healthcare just became too expensive. And that's a sad statement, I guess, about our history, but I have to tell you, after 30-something years of doing this work, I'm more energized today than ever before, because finally I think we're going to get it right. So, next slide. So what are we doing to support our community in the context of okay, that's a slide I didn't know. Oh, yes it is. I'm sorry. No, I'm good. So today, I have to throw this in too. Any of you who are also related to running a business or being part of a business, ours is an interesting business. It is a business, but it's one where you hope and pray that no one ever needs you. So it's an interesting dynamic to stay in business. The good news is the state and the country are finally realizing that they're putting the incentives in the right place. But ours has always been, if we were successful as a nonprofit hospital, we would keep you healthy and happy in your homes and not visiting. MedStar, when we took over Southern Maryland Hospital Center, we focused first internally to really focus on quality and improving quality and safety for our patients. And the other thing we started to do was to get to know our community much better by way of doing a community health assessment. Now that is a requirement as a nonprofit hospital, so it's something that the hospital had never historically done. We did an initial one in a very sort of small and gentle way, But this past fall, we've been broadening that effort, thanks to Danielle Grimes, who's here, and part of our team. And we've engaged a much broader advisory task force made up of our colleagues at the health department, faith-based leaders, grassroots organizers, and other former patients. Great way to improve health is to ask the patients what do they need. And really trying to partner with other healthcare providers in the community to look at where are the needs and how can we improve. So I will tell you, we are just in the middle. We've done an assessment and data analysis. We've surveyed our community, and we've now gotten to the place where we're drafting this community health assessment plan. And that's where I'm truly excited to have this invitation, because I know going to meet many more partners in health here in this room. So I'm very excited about the future working that plan. Just to go back for a second on the next slide, about where we are and what we've been doing. So I put the map up. I'm a geographer's daughter, so I have to have a map always. My father taught me that a long time ago, but it helps give context, and a picture is worth 1,000 words. And one of the things we've been able to do since joining with MedStar Health is to really stabilize our primary care providers and start to grow our primary care providers, which is access, quality, and cost. You heard Steve talk about, and Pam and the doctor. We have to all be working on all fronts, and access is a huge issue. Having insurance is a great thing, and that's what our programs have really improved. But if you don't have doctors who are able to accept the insurance or the new patients, you still have an access problem. So we've been investing in our county, investing in strong ways to stabilize the practices, to branch out, meet people where they are, so that they don't have to come to the hospital and use the emergency room or something worse in that context. One of the really amazing things that's about to happen in March is we will be upgrading all of our physician practices into new software that is actually the same electronic medical record that is used throughout the entire MedStar Health system for our outpatient services. And embedded in that software is this wonderful program to focus on the Million Hearts campaign, which is all about how do we keep ourselves heart healthy. It's one of the areas of the chronic diseases, and so that's a really exciting opportunity to really strengthen the focus of our practitioners in keeping people healthy where they live. In some other ways, you see some more dots on the map there. We are in several other communities with our primary care offices, bringing subspecialty physicians from our tertiary centers, bringing them out here to where our patients are, so that we can again improve access to care. We've also expanded our offerings. MedStar Health happens to be an insurer as well in the MedStar Family Choice Medicaid MCO and MedStar Medicare Advantage. So both of those insurance offerings are now more available in this community in particular, so that again we can help increase the access of our community to our physician providers. So pretty exciting opportunities and continuing to grow. We have a new center coming in Brandywine soon, and so we're looking very much to expand out to where the people are. We're also doing this from a virtual point of view. You heard the doctor talk about telehealth. I mean, many of the efforts we're doing, both of our hospital systems are doing. Virtual health is another way to keep people connected. So the next slide is all about our partners in care and how else can we keep people healthy out in the community. Some of the other opportunities we're looking at are a focus on chronic disease clinics that will be likely consistent with our community health assessment plan. The chronic diseases, as you heard from Steve and from the doctor and Pam, is a huge issue for us in trying to keep people healthy. So we've established a clinic called Partners in Care specifically to focus in on CHF, chronic heart failure, and also disease, COPD. Another side. just to go a little faster for you. We're focused on support groups as well, not just clinics. And I'll have you go on. I mentioned the subspecialty access. So within the last 2 years, we've added some significant presence at the hospital, and the doctors are also doing sort of session time at some of the other strategic locations that we have throughout the community. This happens to be Dr. Lee. He actually became a little bit famous because he took care of a vice president a few years back and actually did his implant ICD device at the hospital center. He actually is a hospital center physician who's now practicing at MedStar Southern Maryland. We also have, next one, brought breast health, fellowship-trained breast surgeon, Dr. Tsiapoli, now here. Her practice, she just started less than a year ago. We've already added a nurse practitioner. We've already are recruiting for another person to join her practice. There's such a significant need. Next slide is our wonderful Dr. Fred Beavers, again, Washington Hospital Center, vascular surgeon specialty, now practicing at MedStar Southern Maryland. Next one. And from Georgetown, we have Dr. Anazi, who's now joined us in neurosurgery. So finally, bringing more of the subspecialties here, more local. And of course, these wonderful surgeons need some special technology. So about a year and a half ago, we added robotic surgery to give them the tools they need to do their work. And another area that is significant is giving access to the evaluation process related to transplant. With diabetes, there's often kidney disease. Kidney transplant is a challenging thing to access, but by bringing the expert team from Georgetown here locally, people can be evaluated and explore the options and talk about it. And if they need the transplant, then they're well connected. So the last couple of slides, it's an important thing to talk about, is healthcare is local. It is absolutely local. As much as we're part of a very large healthcare system, it is all about how do we improve the health here locally. And it starts with all of our associates. Our associates are the community we serve, and we have a very proud group of people who are very excited to be serving this community, so much so that once we became a not-for-profit hospital, our associates engaged in a fundraising campaign to create a mission fund to serve our patients. So when the patients had needs, you can go to the next slide, our annual campaign each year raises money to make sure that we can fund clothing or other special needs. Patients come to us sometime in emergency situations and they don't have the supplies they need to return back to the home. And so it's just a neat way, just very mindful of caring for people is about caring for our associates who are caring for all of us. And so pretty strong, wonderful asset that I'm thrilled to be working with are the folks who actually work in our hospital. So a little, our setting right there on the hill at the corner of Surratt's Road and Route 5. We are also very excited, as much as we've been investing in the community in broader areas, the access points where the patients are living, we also have to reinvest in our hospital setting. And so we're pretty excited about a new construction project that we're working through the design and the approval processes on. But it's very important that it's reinvesting in the ability to serve the community.